Welcome everybody to the Resilient Helena Learn and Act series. My name is McKenna Sellers. I've been working with the Resilient Helena team for about 8-ish months now. Others on the Resilient Helena team, like leadership team, are Diana Hammer, Mark Judeman, Kathy Judeman, and Max Milton are here this evening. So Diana will tell us more about the mission of Resilient Helena, but the purpose of this particular webinar is to connect the community with the resiliency that we all kind of need right now in the COVID crisis, finding out what community actions and mutual aid is going on at this point, and if we have other ideas to share and navigate together in some creative ways. So I think that based on the amount of participants here, that it might be fun to just do individual introductions. And I think we've got enough time for it here. So just very quickly, maybe we can go around starting with the Resilient Helena team, and then maybe I'll call on people to introduce themselves as we go here. So starting with Diana.
Well, hi, I'm Diana Hammer. I'm part of the leadership team for Resilient Helena.
Mark Judeman, part of the leadership team.
Kathy Judeman, part of the leadership team.
I'm Max Milton, part of the our ad hoc group. And
Kyla Mackey is also part of our team, leadership team. I don't see that she's joined us, but that's our group.
Yes.
So McKenna, if you want to advance the slides, I can talk a little bit more about Resilient Helena.
Yeah, sure. And just as some community tips, I guess, just housekeeping item, if you don't mind keeping yourself muted until you have something to say or if you have a question. We have a couple of points throughout this presentation where we will have time for questions, and so if you want to put yourself in the stack, I recommend adding, let's see if I can just go ahead and say it, just a little plus sign. This is something I learned from another Zoom meeting whiz kid. If you add a plus sign into the group chat, which I highly recommend using the function of the group chat, we'll be asking you to do so throughout the meeting here. But if you have a question, put a little plus sign in the chat box and we will be sure to get your question answered in the stack. We will call on you. So for the sake of time, we thought that would be a good option. Okay, and I'll kick it over to Diana to say a little bit more about Resilient Helena.
All right, thanks McKenna. How about one more? Great. So we formed Resilient Helena about a year ago with the idea to amplify the discussion and conversation around climate change. And as many of you know, Helena recently formed the Citizens Conservation Board and with the mission of addressing climate change in Helena, or advising on climate change in Helena. So we formed this group to just amplify our voices and raise awareness in our community about the changing climate and the impacts locally, and to start a conversation about how can we create a more resilient community. So we launched a series of Learn and Act meetings, and the Learn and Act series the meetings are held every other month on the second Tuesday of the even months of the year, so February, April, June, etc. So they can see we've got a website and a Facebook page, and if you're not a member of our Facebook page, I encourage you to join us. With that, I want to talk a little bit about tonight's meeting. We want to talk about what's going on in Helena. There's a lot of good happening in our community, and we want to talk about what is happening. We also want to talk about what's needed. Are there unmet needs? We know of some, there may be others. So just share what we know, and then move on to some creative ideas about how we can support each other, come together, and build that community and create a more resilient Helena. So we'll have, as McKenna mentioned, there'll be time to for all of us to discuss. We'll open it up for discussion and questions for the speakers. And at the end, there'll be an announcement for around Earth Day, and how we're going virtual with Earth Day. So but before we get started, we'd like to just quickly check in with everyone and see how everyone's doing during this challenging time.
Yeah, thanks, Diana. So we're using that fun little poll function of Zoom. We just have 3 really basic questions. Go ahead and take about 60 seconds to fill out all 3. And I'm sorry, I saw that one person joined by phone. We do not have the polling option for phone yet, but maybe once we all become amazing tech experts, we'll get there. But for now, it's just for those who have joined by computer. And if you're sharing your video, if you could give me a little thumbs up when you're done with the poll, then I will know. Okay. Just waiting on.
McKenna, I noticed that some people are saying that they may be having trouble with getting kicked off for high internet activity. It may be that if people have trouble with that, that you could actually turn off the video portion of Zoom and still stay connected to the conversation. So just as a way to stay connected to the conversation this evening.
Yeah, great. Yeah, thanks, Kathy. That is an excellent tip. If you are experiencing internet connection issues, if you stop your video stream, it might help. Okay, well, let's see how the polls turned out. Okay, sharing results. On a scale of 1 to 5, well, we're not pulling our hair out level stress. That's pretty good. Most people are sitting at around a 4. Thank you for filling that out. The second question, 100% of us have heard about mutual aid or community support activities. That's good. And then 3, have we participated in those? About 86% saying yes and 2% saying no. Interesting, cool. That's really great. Thank you for setting up our conversation this way. So I think it might shape the way that we talk about things. Great. Back to Diana.
Well, thank you. So we've got potentially 3 speakers tonight. We arranged for 3 speakers. One is having some internet connection problems. But the 3 speakers we invited are from the Lewis and Clark Public Health Department, from the Helena Solidarity Network, and from Elevate Montana, the local Helena affiliate. And so, has Eric joined us?
I have. This is Eric.
Great.
Yeah, that's my wife's name. On the computer here, that's what we're checking in with. So, but I'm here. Yeah.
Great. Thanks, Eric. So our first speaker is Eric Merchant. He's with the Lewis and Clark Public Health Department, and he is the administrator for the Communicable Disease Control and Prevention Division. And we're so happy to have that you were able to take time. I know the health department is super busy, Eric, and we really appreciate you being here to give us an update about the efforts of the Lewis and Clark Health Department.
Great. Thank you. Yeah. These are interesting times, to say the least. Certainly at the health department, this is the kind of thing that we have, prepared for in both as academics, and we got into our careers, and we were ready for this kind of thing, we thought. But it really certainly is something that I have looked at and said, wow, I can't. It's hard to imagine all the layers to these issues that we're dealing with right now. And it's really important. I think you're going to see throughout my theme here tonight that everybody's doing their part, that everybody's working together. Sort of the cliche with COVID-19 is that we're all in this together, but it's really so very true. And So with that, I just wanted to kind of start off. Are you guys ready for me to start in earnest with what I wanted to say, or is that? Yep.
Yes,
Yeah.
great.
Yeah,
Okay,
start
great.
right in, Eric.
Okay, so I guess what I'll start with is not something I'm not going to spend a lot of time on, but public health is acting in the lead role as the lead agency in the county's Unified Health Command. The Unified Command includes public health, the sheriff's office, the Helena and East Helena police departments, and then St. Peter's Health. This is all part of an incident command structure, ICS, that has been established in response to the COVID-19 pandemic and how we're going to respond to that at the local level. Again, I don't want to spend too much time on ICS structure, but we are definitely every morning we spend at least a couple hours identifying priorities within the community, and then acting on those, taking our own roles and moving off and making sure that those things are getting done. So that's kind of where I wanted to start on, is what is the specific role of the health department in fostering community resilience during the COVID-19 pandemic, and really in addressing the response to this novel virus. Our primary objective is simple. It's to prevent local disease transmission. It's as simple and complex as that. Local public health is the chief health strategist for the community related to the COVID-19 response. What I mean by that is we play a lot of different roles. We educate and help local partners to develop plans and to identify how they can best protect assets, whether that be business assets or whether that be people that they're protecting or sharing spaces with, etc. And to help to stem the potential local outbreak. We're working very hard with doctors, businesses, hospitals and clinics, community organizations such as yourselves, government entities. All sectors of the community must be represented in order for us to be effective. It's important it's important that all affected entities do their part. The health department's role is to help facilitate preparedness and resilience. It is not the role of the health department to develop specific plans for affected entities, related to many things. Again, the health department's objective is simply to control COVID-19 and to assist other entities in an advisory role. We set policy. I think a lot of what I've been doing in my role as an administrator is setting policy as to how to comply with local and state orders, establishing legal precedent for issuing orders at the local level. We educate on how to safely comply with orders and directives. And then, hopefully we don't get to this point, but we have seen a couple instances where we need to enforce orders if those entities are not complying. And I'll get a little bit more into what I'm talking about there as we talk about, a little bit more specifically about what the health department does. So moving to that, how does the health department accomplish these objectives? At the base level, and the most important thing that the health department does in response to a pandemic is we do case and contact tracing activities. And some of you may be aware of what that is, but I wanted to expand on that a little bit. What we need right now, what we are starting to see is widespread community testing to identify cases and to support epidemiological objectives. When cases are identified very specifically in our jurisdiction, we've had 16 cases to date. It doesn't seem like a lot, but it's a heck of a lot of work. When we identify a case, when we get a confirmed, we contact that individual. We order isolation of that case. That means that we're requiring that person to wherever that place may be, whether it's in their home or a shelter setting or something that the county has established, or others to establish a place where they can be isolated from all other folks. That is really critical. Hopefully it's a space where they have a room that they can be in, they have their own bathroom, nobody else is using any items or so what we're going to do with that is we're going to isolate the case, and then we're going to work with them. We're going to interview them to make sure that we understand where they've been, what they've been doing, who they've been with, and that last part of it is the most important piece of it. We are very interested in identifying contacts to cases. And in that situation, what we do is we quarantine those individuals. So if you're a direct contact to an identified case, you will be in a situation where you're going to be quarantined for at least a 14-day period to go through a communicability cycle. And then at that point, you would be released from that quarantine situation. During that situation, you would be monitored. You would be monitoring for symptoms consistent with COVID-19. And if there were a situation where you had those symptoms occur, then that would be the next step would be to directly work with your local your healthcare provider and to determine, and or the health department to determine next steps. The isolated cases would go through a slightly different, as I said, they're isolated away from folks, and then when they're at a point where we believe they're at a point where they're ready to be released, there's a few different criteria that they will need to meet. One is going to be testing to ensure that they're not, continuing to carry that virus and be someone who can go about the community and transmit it elsewhere. But that process is really important. I mean, I'm going to stress that is the most important thing that we are doing, and we are going to make sure, and that is going to be a huge key critical factor in when and how we get back to life as normal, right? So I wanted to move on from that and talk a little bit about case and contact management. So we do issue these isolation quarantine orders, and then we have daily follow-up with our staff, either nursing staff or a team of folks that we've identified as isolation and quarantine management team. And we're going to daily follow up with isolated cases. And then at this point, what we do is we have weekly, or sort of a couple times a week, we'll be in contact with the quarantined individuals. That can be more often depending on the case. That's really a case-by-case situation as to how comfortable we are with understanding that that person is complying with the obligation to quarantine themselves. Public health and local law enforcement, in any situation where we identify that someone is not in compliance with an isolation or quarantine order from the local health officer, we would immediately be on that and respond to that situation. That is not something that we can allow to happen, because we know clearly that would be a situation where we could, escalate or could result in a cluster or an outbreak of COVID-19 in our community. So this, as I've already alluded to, this is really probably the most critical factor in stemming the outbreak, preventing those that are sick with direct potential to be sick from interacting with others. It's as simple and complex as that. And then the other thing that's really kind of on people's minds, I think more than anything, is the issuance and enforcement of the governor's orders and directives. So for example, as everybody understands, I'm sure everybody by this time is aware of what social distancing means, and that the governor has issued stay-at-home and non-essential business closure orders. And these, first of all, I want to identify that we get it. The health department understands, and we hear every day how frustrating and tough this is on individuals, business owners, and really just generally people trying to live their lives and maintain mental health, and those that don't have support, those that don't have, there's a lot of folks out there that are having a really hard time with this, and that's not lost on us. That's really important to understand. Quite contrary, we do understand that, and we are reinforcing and supporting those folks out there that are helping to stem that issue, or to curb that issue a little bit. So as I said, for example, one of the biggest things we're doing is setting policy and identifying how it is that our community, our jurisdiction is going to implement and enforce those orders coming down from the governor. I wanted to also highlight the leadership in our community. The initial orders for closure of non-essential businesses were issued by our local health officer, not the governor. And so I wanted to just highlight the local leadership and the strength of Brenda Neiman, who's our health officer in our community, and her willingness to step up and get in front of this thing even before it became a state issue. I think that's really critical. We've seen around the country that those that acted earlier are in a lot better shape right now, and I think that's really apparent in our community in Lewis and Clark County, specifically with our low caseload at this time. Also, the governor followed up with a timely and strong leadership for statewide orders and directives. Early action has no doubt limited the incidence of disease in our state and in our community. So our local enforcement of these orders, this is a complaint-driven process. It's through local public health enforcement team and local law enforcement, both the sheriff and the police departments. The process is, if we receive a complaint related to something like, there's a social gathering going on in my neighbor's yard. There's several people over there, or there's 20 kids and their parents doing an Easter hunt, or that wouldn't have been very fun on Easter this year with all the snow. But those types of things are things that we need to hear about, and so we want to hear about those. And so that would be constitute a complaint. The health department provides, in that instance, we would get that complaint. We would provide education and outreach regarding the intent and the importance of the order and why it matters that we follow through with these activities. If we receive a second complaint, let's say this time it's a business, a restaurant that it just refuses to shut down, and we receive a second complaint after we've done education and outreach with that entity, we would issue what's called an order for a corrective action plan, an order for corrective action. And that would be basically a warning that's issued by the health department to tell that entity, hey, you know what, we understand, we've got a second complaint on you. You're still open, you're still serving food inside your establishment. And we want to help you understand that that's not allowed and the reasons behind that. And here's an order to say, a written order that will be delivered by law enforcement to say, you're limited to operations that are, for example, curbside pickup or, some other strategy, online strategy, or something like delivery, something like that to, keep your business going. We want you to be creative in that effort, but you can't do it the way you're doing it right now. And we need to issue an order at this time. And then hopefully we have not gotten to a third complaint. And I hope we do not, because at that point, you're really looking at someone that is just unwilling to adhere to the orders, and I think in such cases it's really they're just not thinking it through, because this is as simple as preventing disease transmission. It's not about anything other than that. It's not about being punitive with businesses. It's not about anything other than stopping people from being near each other, physical distance, so that we can stem this viral outbreak. In such a case where we got a third complaint, there would be a citation issued by law enforcement, and prosecution would go through the county attorney and district court. So I don't want to spend a lot of time on enforcement, because I really hope we don't need to go that way very often. But we have had a few instances where that has been necessary. So really our focus here is education, outreach, and coordination with community partners. Local providers, we have a meeting every Thursday. These would be primary care providers. Plus, all day long, many phone consults with our public health nursing team and local physicians. That is obviously an important factor here. Local and state disaster and emergency services, or DES, our local emergency operations center, or our EOC, community organizations active in disasters, or COAD. I'm going to talk a little bit more about that in a minute. Our law enforcement partners, obviously the general public and affected businesses. We have an open public forum call every Friday that I manage, and so if you go to our website, you can click right into that and find that we do that every Friday morning. And we usually have it'll sort of be the issue of it will give a situation update, local, state, national, international update on COVID-19, and then we'll go through some things that are important, issues that are important for folks to understand. And a lot of times it's going to be focused on businesses, because that seems to be whom we've got in there most of the time. But we'd love to hear from anybody out there that has a topic they'd like to discuss. And we would love to do that. So then we also have established since the outbreak has started, meetings with select businesses that provide services for high-risk populations. That would be homeless shelters, assisted living, group homes, detention centers, healthcare providers, etc. There's a lot of that going on as well. We want to make sure that everybody understands what they should be doing and why. Okay, so kind of moving on and trying to get through this a little more quickly. I had a lot to say, I realized, as I was putting this together. So the next topic I wanted to discuss in sort of broad scope is how will the pandemic end? Ultimately, with a novel communicable disease, we are working to achieve what many of you may understand or what we call herd immunity. The pandemic will end when a sufficiently high proportion of individuals within a given population are immune to the disease. That's it. There's no other way to do it. Communicable disease immunity occurs through just two processes, and that would be either prophylaxis when we have a vaccine available, or through disease itself, or through potentially some sort of strategy where we're like we're doing right now, which is social distancing. But really, what we're looking for there is just to slow or flatten the curve, as everybody says, and allow our healthcare infrastructure to manage the disease to a point where we do have prophylaxis, or we have had enough disease, hopefully not, where we have a high enough proportion of the population that the virus can't make its way back in. Importantly, what we see with a lot of pandemics is we have a first wave, and then we get things under control, and then we have a second wave, which oftentimes is worse. We remember that from the Spanish flu of 1918. That was real apparent there. So communicable disease immunity, as I said, through two processes, due to highly contagious nature of the virus that's responsible for COVID-19 and the current lack of prophylaxis, strategies to limit disease have focused on social distancing. Social distancing means intentionally staying away from each other. It's a real easy thing to say, a really difficult thing to do. From the moment that we get up in the morning to the moment that we go to bed at night, we are absolutely interconnected to our families, our friends, our community. All of us in this community are connected to each other. It's become so apparent with the outset of this pandemic. The social distancing strategy is essentially being used to slow the spread of COVID-19, as I said, so that our healthcare system is not overwhelmed. By applying social distancing strategies here in Montana, we have what I believe is a real opportunity to get to the point of prophylaxis, to protect our communities without realizing significant disease and death, as is being experienced in different parts of the country. In part, this is due to the natural social distancing that occurs in Montana. We don't live the same way as folks do in New York. We don't live on top of each other. We aren't constantly in contact. We're not all using the very same utilities all the time. And so we have sort of an advantage in our community as it relates to, and specifically in our community, as it relates to that. And so I just wanted to note that, because people have probably thought that through, but it's really just another element of social distancing, right? We just have sort of a kickstart to social distancing where other places don't have that opportunity. But most importantly, what I want to say, how are we keeping the incidence of disease in check? Most importantly is our resilient and prepared community is keeping our disease incidence low by complying with social distancing obligations, by not getting together, by doing things like we're doing tonight, by Zoom meetings. My goodness. Who would have thought that this would be the standard just a month and a half ago? It's going to change everything. And this is one of those things that we're seeing happen pretty regularly. Just the bottom line point is, even with our increased testing rates in our community and across the state, the case numbers remain relatively low. That is really a direct result of the people in our community, of all those people across the state of Montana that are willing to make certain sacrifices to social distance and to stay away from folks. So what I wanted to also just start with some ideas of what you can do to be more resilient and be prepared as individuals, businesses, etc. And this is not by any means an exhaustive list, and I'm assuming that there will be some great ideas out there. But it is our community response to public health protection, such as social distancing, stay-at-home orders, and limiting places where folks gather, such as restaurants, bars, campgrounds, etc. That's currently and will continue to keep our disease incidence low. We need everybody on this call, everybody who is out there, all your family members, all your friends, be advocates for this. I know that it's challenging for folks that are missing a paycheck, or folks that are aren't able to see their grandparents or visit their loved ones, or anything like that. But we got to be on the bandwagon. We got to be promoting that strongly and in positive ways, because it's working. We all need to do our part, be vigilant and supportive of the directives and orders. We need to lead by example. Everybody, that's a cliche, but it's true. If we believe in resiliency for our community, and if we believe that means to follow through with what is being required of us, then we need to lead by example. That's really important. We need to develop plans. Every individual and organization needs a plan. Are you prepared for long-term social distancing? Does your business have a plan to get through an economic downturn? Does your social service have a plan to isolate individuals if they become sick? I mean, those are just basic questions, but they're really important questions as we try to get through this. People need connection even in a virtual world. Connect with your neighbors from across the fence or street. Call your family and friends. Mental health matters today. Take care of your own mental health. Go for walks, ride a bike, start a new hobby, do something socially distanced that will occupy your time and really enhance who you are. Businesses need to be creative. How can they continue to serve the public without putting the public at risk of disease transmission? The governor's orders are highly ambiguous, you guys. There's a lot of things in there. There's a lot of loopholes. I think that's intentional. What we need to be doing is looking at the order, understanding the intent of it, and that is, again, social distancing, staying away from each other, stemming this disease, right? Got to be creative in how we're going to do our business. Work with or join organizations, maybe such as yourselves, that are interested in doing volunteer work, being that safety net for the community, working hard to provide that mutual aid for whatever group it is out there that is in need. I'm highlighting today the Elkhorn COAD, or the Elkhorn Community Organizations Active in Disaster. That's something that's available for volunteers. So what is the role of the COAD? Very specifically, the role of the COAD is community resiliency through preparedness. Feeding, sheltering of those in need. COAD has worked hard to secure the following. Sheltering for folks that are identified as positive in high-risk populations. So the Journey Home has been looked at, and many of you may be aware of this. We're looking at the Journey Home, the county is, for inmate isolation housing, the fairgrounds for homeless isolation housing, and other situations, shelters where folks don't have a place to go. Because remember, if you're isolated, if you're a case or a quarantine, you need to have a place to be to fulfill that obligation. The Jan Shaw building has now been identified as a place for first responders who need isolation. There are local hotels we're working with through the Rocky Mountain Development Center and others, local hotels for individuals, again, that don't have a place to go, that are experiencing homelessness, or that are, otherwise don't have a place to be. We want to make sure that, or even for overflow, to reduce communal living in certain locations like God's Love or other, service providers in our community. These are really critical things that the COAD is doing, working with county administrators, with other officials, with the health department, with other organizations, volunteer organizations, to make happen. It's been a challenge, and that's something that we've identified for our after action process on this whole thing, when it's done and gone, and we're looking back at what went well and what didn't go well, was actually the planning prior to the outbreak could have been a little better as it relates to things of that nature, but we're getting there. And that would be something that folks can do, working with the COAD to further their project, their objectives. So the question of the day, I'm trying to move this along here. As I said, I had a lot to say. The question of the day is, how and when will our businesses and communities ever get back to normal? Normal is very relative, I think. Normal may not be the way it used to be, at least for a while. We need to remain vigilant with certain aspects of social distancing. Avoid large gatherings for some time to come. I think that is something we just have to get used to for a period of time here. Getting back to normal will more than likely occur gradually through a phased and regional approach across Montana and the United States, based on the following or similar criteria. Sustained reduction in local state cases for at least a 14-day period, the communicability period. Local hospitals and clinics must be able to address all patients without the need for surge capacity and crisis mode operations. Widespread testing, this is critical. Widespread testing must be available for all individuals with symptoms consistent with COVID-19, and more importantly, I believe, preferably anyone who wants to get a test should be able to get a test. That's just a fact. Of course, there's issues. If you're asymptomatic and you're early in disease, a test is not going to show anything. But we are aware that at some stages, asymptomatic patients are spreading the disease. And so we need to understand that. Widespread testing will show us where we are and how each community, or maybe, you know, regional 3 county areas, or whatever the criteria may be, how we can start to slowly open back up as a community. And then most importantly, as I started with, local public health department has to be able to conduct its case and contact tracing without our surge capacity in place. This will be the key. Right now, we have our surge capacity established. We've got 12 to 14 additional nurses that are sort of waiting in the wings right now. Should we get to a place where we need that? Right now, we're managing that pretty well in our community, but that may not be the case as we move forward. So some of those things, I'm not really looking right now at any reality of opening back up for quite a period of time. I think that what we've got in Montana is a real opportunity to avoid disease, especially in this first wave, and then an opportunity to look and see where we are as we prepare for next fall and into the winter, when we anticipate we may have additional cases in advance of having a vaccine available. So this is a long haul, folks, but everybody's in it together. You guys, I'm really pleased to see that this is going on. There's a lot of organizations, entities that are doing things in a positive way. It's all about that. It's about being positive and supporting each other through this. And again, we're very fortunate to be living in a state where we don't have the disease and really the crisis that we're seeing across this country, but we cannot get complacent, because that could be here as well. So I didn't have anything else, but certainly I'm here and available to answer questions from the health department's perspective. And Diana, I just wanted again to thank you for the opportunity to have the forum here.
Thank you so much, Eric. I think we'll hold questions until the speakers are done.
Okay.
But thank you so much. Our next speaker is Julie Cruz with the Helena Solidarity Network. And Julie is the leader of the Helena Solidarity Network, and she's co-chair of the Helena Democratic Socialists of America. So she's going to give us a heads up on what the Helena Solidarity Network is doing and how we could be involved. So Julie, I'll turn it over to you.
Thanks, Diana. McKenna, give me a thumbs up if my microphone's working. Thank you. Okay. As Diana said, I'm a member and co-chair of Helena DSA, which started the Helena Solidarity Network a month ago yesterday. DSA believes that now more than ever, both our healthcare system and our economy should be run democratically to meet human needs, not to make profits for a few. So that's kind of our bedrock. It's hard to believe, but only a month ago, we barely had an inkling of the extraordinary measures over many months that it would take to make all of us safe from this coronavirus. Most people in our community, as we just heard, understand the threat and thankfully have been acting accordingly with minimal intervention on the part of our city or county government. Lewis and Clark County has registered only 16 cases and only 7 so far in April. So we know that it's been hard on everyone, but it's what we have to do to stay safe and to be well. While it's true that community transmission is always going to be the hardest thing to control, it's also true that community solidarity is going to be the only way to control the spread of the virus. Social distancing is either going to work for those most susceptible to COVID-19 or the economic fallout of the pandemic, or it's going to fail us all. at least until repeated testing and tracking are ubiquitous and a vaccine is mandatory and free. Our motto, or our meme, is solidarity is a verb. It means that what we do is really what counts, not just what we say. And in this case, solidarity is an act to replace our systems of individual focus with attention to our neighbors, our neighborhoods, our city, county, state, nation, and the world. We participate in social distancing for each other, but it's hard to know if it will work, especially in light of the attention on economics and efforts to distract us from this work. We've been told that government is the problem, and look where that's gotten us. Our healthcare systems make profits for few, but can't save the many when we really need them. We don't know many of our immediate neighbors, let alone think to care for all of them, except in a 100-year crisis. We don't live in a country that acts like a country anymore. We live in a failed state. So Helena DSA has established 9 totally volunteer neighborhood networks covering right now about 25% of Helena, each anchored by a coordinator, some of whom are DSA members. What we do is go beyond the normal and the necessary, what we might have previously called personal charity between people we know, but rather to offer mutual aid to anyone and everyone in our neighborhoods and make sure that no one is left behind. It's estimated by some that as many as half of the deaths in New York City may have occurred at home or on people's own turf, and thus not really recorded in the official statistics. We've already contacted several hundred Helenans by email, inviting them to register on our network. It's a Google Doc, and it takes about 5 minutes to fill out. We are now canvassing our neighborhoods and distributing door hangers to engage more people in each neighborhood. They register on tiny.cc/solidarity is a verb. That's where the doc is. And they can indicate either support that they need or support that they can provide. Neighborhood coordinators then make the connections for needs to be met. It doesn't matter what our neighbors need, from shopping to a daily check-in to help with rent. We will try to meet the needs of our neighbors, whatever they are, however we can. We both teach and follow really stringent standards of support for this work, following best practices, and in some cases recommending that our neighbors use even more stringent habits than those recommended by the CDC. When it's not feasible or appropriate for a neighbor to provide direct support, we try to connect folks to other community resources, for example, through the United Way's Montana211.org. In doing our work, we've learned a few things. First, lots of people in Helena live alone. Many of these are advanced age, and because of that, they are at most risk during this social distancing. These neighbors are not being reached. We need more neighborhoods to be coordinated. 25% isn't enough. Secondly, many of our neighbors in need may not have computers or cell phones or access to communication that many of us take for granted. If we want to reach those who are truly in need, we will need to approach communications from many different directions, including socially distanced person-to-person efforts. Thirdly, since the effects of the governor's stay-at-home directive of March 26th are just now fully being felt before it will expire on April 24th, we don't yet know how the massive unemployment and its attended forced poverty will affect how people can afford to pay rent or mortgages, although the governor has begun to actively address that. feed themselves and their families, pay back student loan debt, pay their health insurance premiums, deductibles, copays, etc. There's a good deal of apprehension about just what the future looks like for a lot of our neighbors. It is going to be different. Our network is committed to building a Helena Solidarity Fund to help meet financial needs of those in the network. The fund is likely to be seeded with donations of our $1,200 federal aid checks from network supporters who state that they don't need it and encourage others to do the same and donate into this fund. But we can do more. Even though Lewis and Clark County has been relatively uninfected by the pandemic, coronavirus is going to be with us for a long time. And when the governor has done a good job to date of preventing its spread in Montana, he's also under tremendous pressure to reopen the economy. Before he does, and that has some likelihood of being when the current directive expires in 10 days, we're advocating that he monitor all major highway entrance points, as he's currently doing with airports and Amtrak stations. Travel is still the main way that community transmission starts when infected people come in from out of state as weather warms. And it seems very logical that if our numbers remain as low as they are, people will want to come here. We've spent the last month developing and field testing these methods. So tonight we're publicly launching the Helena Solidarity Network, and we invite everyone on this call to register on our network. All the data in the network is completely confidential and your privacy is protected. We are especially looking for more coordinators to connect neighbors to neighbors in the areas north of the railroad tracks and east of Montana Avenue. We're currently, we don't have a reach in those neighborhoods. Coordinators are currently canvassing with door hangers. I'm delighted that some of you found one on your door. And you can find a copy of that at our, a part of our Facebook Solidarity is a Verb page. So facebook.com Solidarity is a Verb. And we invite you to continue the good work with us. Thanks.
Oh, thanks so much, Julie. It was really helpful. And I did find the door hanger on my door this afternoon. Thanks, Marshall and Bonnie. So our next speaker was to be Rebecca Hargis with Elevate Montana. She's the chairperson for the Helena affiliate. She had poor, we did a test run last week and it worked just fine without the video, but tonight she got kicked off too many times. So Kathy has put Elevate Montana's website link in the chat box if you want to link, check it out a little bit more. But basically, what they're concerned with is mental health issues and building resilient kids and families. And so resilience has a lot of meanings. You can talk about personal resilience, community resilience, ecological resilience, and Elevate Montana is really focused on the personal and family resilience, which helps us have a more resilient community. So she sends her apologies, and with that, I'd like to turn it over to Mark Judeman to talk a little bit about supporting local businesses.
Yeah, actually, there are several things I'd like to talk about. One of the big impacts we're seeing with the virus and the shutdowns is our impacts on our small businesses, small local businesses, which are the lifeblood of our community. And there is a Facebook group that has been put together, which is sharing information and resources, Small Businesses of Helena. If we go to the next page, please. Next slide. they're helping provide connections with those restaurants that are providing takeout and curbside pickup. They're suggesting that folks buy gift cards and gift certificates from their favorite local businesses. There are ways to shop local stores online. You can look at individual business websites. Also, if you go to the helenasmallbiz.com website or the helena.shopintown.org website, you can find links to enable you to purchase from local stores. And then again, the Facebook page, Small Businesses of Helena, that is open not only to small business owners, but the community as well. And so if you were to go and join the Facebook page, then you can see many of these resources. Local businesses are posting what they have available. They're suggesting how people in the community can support them. And it's just a really great place to find that information. Okay. There are some other great resources as well to help support all of us, our community, in this time. The City of Helena at helenamt.gov has COVID-19 resources on that page. City Commissioner Dean has a wonderful resource page at deanforhelena.com with lots of helpful links. Please check that out. Lewis and Clark Emergency Management has a Facebook page. I've been following that for some time. In the past, it's been for weather and for fire reasons, but they are also helping us with the COVID-19 response. Another useful Facebook page for finding resources to help you if you need it, and also opportunities to help others, is Caremongering, Helena, Montana. Please join that Facebook page. It's a wonderful resource. Many of us here probably are members of Nextdoor. That is like a social media platform for neighborhoods. You can join the neighborhood in which you live, and only people in that neighborhood who have been verified are able to see your information. You can request references, referrals, ask questions, let people know that you found a missing animal, things of that nature. So nextdoor.com, it's a great resource. The students at Carroll College have formed a group, Carroll Cares. I checked with them today and they responded that they are still active even though the college is closed. They have a phone number, 406-282-4847, if you'd like to contact them with a need that they might be able to help with. And I'm sure that we haven't captured all of the resources that are available in our community. If you have any other resources, please add those into the chat box so that we can capture those and share those through our Facebook page and through our website.
Great. Thanks so much, Mark, for that rundown. I went ahead and asked a question and used my facilitator privilege to ask the Helena Solidarity Network folks, Julie, Marshall, or Bonnie, if you're able to answer. Is the Carroll Cares, I thought I saw that they might have been connected with the Helena Solidarity Network. Can you guys maybe speak to that, if that's true? Maybe it was just what I heard.
I'm trying to unmute myself, just a second. Okay, so this is Julie, and we do have a portion of the Helena Solidarity Network that is covering the Carroll College area, but I made a note of myself to get that group in contact with Carol Cares, because I think they're two separate entities. Thanks.
Cool. At this point, we'd open it up for questions for Eric, Julie, or Mark.
I have a question for Eric.
How can I help?
So I social distance in my life usually anyway, so I'm not really plugged into the wider community. And I'm just wondering what it's like out there in the broader community. I know in this people, the kind of closer into downtown, and some of the people I know that are on this call, I have a sense, but I don't really have a sense of the larger community as far as people's comfort levels and I don't know, whatever seems to come, you've noticed in your work.
Yeah, it's a good, and I don't know all the angles to start there, but I think what I've noticed really is this sort of adapting to it, right? So at first it was really foreign. I mean, even for myself, being in this business of protecting the community from communicable disease outbreaks, it was a really odd thing to get your head around what this social distancing thing, because it really is every single thing, as I said before, from the moment that you wake up to the moment that you go to bed at night, you have to be thinking differently. And so what I've noticed is that that's happening. I think that people are getting more and more comfortable with it. I know that it's getting harder for some with certain situations, but also I recognize in town, it's just different things. You're not seeing groups of folks together very often anymore. There are certain circumstances, but it just feels like the community is getting on board with it and finding ways to do things differently, which is really what it's all about. We can still do and live our lives. We just have to think about it and do it differently. So I don't know if that gets to what you're saying or what you were asking at all, but I've really noticed that in our community, folks, walking around. I spend a lot of time hiking, and I've continued to do that in the city parks. And I've really noticed a difference up there too. Folks are really cognizant of this idea that it's as simple as staying away from each other to stay safe. And that's been sort of my the biggest thing that I've noticed is just that people are buying into this and understanding it. And look, they're getting to see that our cases are limited, our contacts are limited, and so we're doing a good job. And I feel like the community is coming on board with that.
Okay, thanks.
Great. Denise had her hand raised. You can see that little blue hand. Sorry, I missed it originally. And then Lisa will be after Denise.
So I just have a question about distributing material around town via door knocker type stuff. Because, we do have a shelter in place order. It is ambiguous. We are allowed to go out to go hiking and walking, and but there's like the distribution of materials that I touch, I put on your doorknob, I'm touching your doorknob that you've touched, and now you're touching the door hanger, etc. So can someone speak to that? Because I know the Helena Citizens Council has been talking about distributing materials, and I just wonder about it, whether or not we should be doing that.
Yeah, Denise, it's a really good question, and we struggled with, this is Julie, we struggled with it quite a bit when we were trying to decide what direction to go to try and reach people that we knew we weren't reaching via email. And so we designed a door hanger that can be placed on a doorknob or any kind of a hook or something. It's attached to a rubber band. And so all it touches, I mean, you don't have to touch the doorknob. So so we have trained our volunteers. There shouldn't be any touching. If you can't hang it on the door, you slide it under a mat. If you can't slide it under a mat, you mark it on your paper that when things loosen up, we might want to recheck in with this house because we couldn't leave a door hanger on their door. You wear gloves, you wear a mask, you socially distance. If someone comes to the door, you are backing out. And so, you know, we feel that we have followed some pretty stringent protocols and taught our community neighborhood coordinators exactly how to go about this, and in order to keep themselves safe, and in order to make sure that that everyone upon whose door we leave a message also stays safe.
I would add to that too. This is Eric Merchant. Yeah, I think we have a good understanding that this virus has a relatively long efficacy on certain surfaces, and so that's what we're getting at with sort of trying to make sure that, you know, ordering out or having things put on your door, et cetera, is safe. And those sounds like a really great plan that you have, Julia. I think that what's happening is we need to rely on those businesses also to follow through with all the requirements, stay home, or, you know, all those recommended hygiene, you know, respiratory health, personal health and hygiene practices, looking at their employees, understanding that their employees are not coming to work sick, symptomatic. So those folks that are in that environment that are providing a service to the community are not, you know, obviously in a condition that has potential to impact those people they're serving. You know, so that's a big piece of it. I think that a lot of the businesses, like Julia, like you're identifying, have taken proactive approaches to, you know, things like disinfecting surfaces that they're providing, wearing gloves and then disinfecting before it's dropped off, never dropping it off at the end of the, you know, walkway leading up to the house, and not going to the door in many cases. There's a lot of different strategies out there. We get a lot of calls about that. And we have creative people that are trying to help businesses to be creative themselves in maintaining safe practices if they're going to be open and providing services. That's great, Julia. That's great to hear that the protections you're putting in place there.
Thank you. Great responses all around. Lisa, did you have a question up next?
Yeah, just a couple of quick questions for Eric, I think. And so Eric, just a definition, what's the working definition between isolate and quarantine? What's the difference between those two?
Yeah, okay. Sorry, I probably should have done that when I was talking through that. Isolation is for those folks that are symptomatic. So we've got an individual that is symptomatic and is waiting for a test, or we've got a confirmed case. That person would be isolated. A contact would be, a direct contact would be someone who has had contact with a case, with a confirmed case, and they would be under quarantine. Okay, so cases are isolated, contacts are quarantined.
Okay, but what's the functional difference between being isolated versus being quarantined?
So there's a couple things. So isolation means we want that individual in a room by themselves. We don't want interaction with that individual unless it's necessary. We want that person to have their own room and their own bathroom. And quarantine and they are not to leave that environment until they're released. And that's going to happen through typically going to be testing, okay, to release that person from isolation. Quarantine means stay at your place, you know, stay on the premises, but, you know, and try to limit your interaction with individuals that may also be there, but it's not the same level. And there is a specifically defined date on that too. So you're not released based on testing data. You're released based on a 14-day period from the time that you had contact with that case. So there's a good distinction there, but it's sort of in both cases, what we're trying to do is make sure that individual is not coming into contact with others in the community.
Yeah.
Except those folks in their own home. Yeah.
Great, thank you. My other question is just a little follow-up, and I know this is one that doesn't have a firm answer, but when you say won't be opening up for any time soon. And we're hearing the governor saying, you know, the 24th likely to be extended. But what's your gut sense of what that could be?
Boy, I don't have a crystal ball, but
I know I'm not asking for that, just your gut sense.
no, and I'm a public health professional, and so I'm you know, my perspective is going to be based on public health protection. First and foremost, I understand all the layers around that we've got real issues with folks that are out of work and unable to pay bills and doing those things, and that really impacts people as well. So I think that is the reason why, you know, we're seeing this, you know, largely political push to get things back open. But the science has to be there. We have to have those things in place. We have to have solid testing for everybody so that we can identify and understand what's happening. We have to have the ability to manage. Our hospital system has to be operating. We have to be able to have, you know, all those other things that go wrong with people, not just COVID-19. COVID-19 is not the only thing happening from a health perspective in our community. We have to be able to serve all the people with our hospital resources. We have to be able to do all the, you know, contact tracing and casework that we need to be able to do. There are a lot of things that need to line up. In my heart, in my, you know, if I did have a crystal ball, I think what it would show me is that we will likely, if we do this from the perspective, you know, from a scientifically based reasoning, use scientifically based reasoning, we may be in this situation through May, at least.
Yeah.
Thank you.
Thanks.
Yeah, that's great. Really helpful. And I also noticed that Marshall augmented Julie's answer about how going door to door and the protocols that Helena Solidarity Network has in place to avoid contact. So thank you for that. Okay, Jesse has a question, so I will give it over to you, Jesse.
Can you guys see me or hear me? Okay.
He lost his video or his
Oh.
audio.
Yeah.
Yep, there we go. Okay, now you're good. Yep, you're good now.
When, in your opinion, Mr. Merchant, can we plausibly see widespread free testing?
Okay, so that's a tough question. I think because the tests themselves are much more readily available now. It's been a lot of what's been happening with our limited testing, and we have done a fairly good job here in Montana. I mean, it's been slow to get out of the gate, but we're really ramping it up. I think we've done something like 1,000 tests in Lewis and Clark County now as of yesterday, and that's ramping up pretty quickly, but not nearly enough, you know, with 70,000 people in the jurisdiction, living in the jurisdiction. My opinion is that it's more dependent on other supplies at testing you know, at clinics and at St. Peter's. But I think that we're going to get there really quick. There's a real hard push from the state health department right now. We're working with our community healthcare providers all the time, and we are, you know, the algorithm for how you get a test done has changed, you know, significantly through time. It really was highly rigorous. It was really hard to get a test right away, just because it was based on we don't have a lot of tests available. We don't want to waste those tests, so to speak. But now we're seeing the tests themselves, the test kits themselves are available. There's a strong push from the state's health department to get as much get those providers out there to order as many tests as possible, because it's very much dependent on the provider to make that decision. Public health is the reporting agency, so we get the reports and we do the contact work in cases, but it is the provider that makes that decision to do the testing for a patient. Okay, I don't know when we'll get to a point where anybody can say, you know what, I feel like I had something. I'm out there. I'm going to go see if I can get a test. I don't have symptoms. The other thing that is going to be really important here, and sort of an offshoot of that question, is when we're going to have serology available, which is going to show us folks that had the disease but are no longer sick, they have the antibodies in their blood. And that's going to be extremely important from an epidemiological perspective. I think that'll happen. That has started through CDC in some of the hot spots in the nation, like New York. And we anticipate, hopefully, that will be something that the federal government will get on board with and really do in mass quantity across the nation. But Marshall, that's a really good question. I'm just not sure when we're going to see everything open up to testing just be for everyone at any time. And a lot of that is also because the test rate, it's not going to show certain individuals unless you're in a certain state. Or not state, I mean, not state being Montana, but a state with the disease, a certain place with the disease. So sorry, it is absolutely opening up compared to what it's been. We've seen a lot of testing in just in the last week or two, less last week than the week prior. I'm not sure what that was about in our county, but we are seeing those numbers ramp up, and that's good. That's a good sign.
Great. Thank you. Thanks for that response there, Eric. And it looks like Marshall had the same question. So thank you, Jesse, for the useful question. We are running a little short on time, so maybe we will finish the second half of addressing community needs, and then Denise, and if there are any other questions, we can wrap them up at the end. Does that sound good to everybody? Okay, great. So I will pass it on to Kathy Judeman to talk more about the community needs that we've been hearing about, and this would be a great time just based on those that are on this call and on this webinar right now. If you have other needs that you have seen or identified, we'd love to hear about them. Go ahead, Kathy.
All right, thank you so much, McKenna. I know that from the first description that you all filled in, you're kind of familiar with what's going on in the community, so I won't have to spend quite as much time on this section. I will talk just briefly about what's going on with a couple of these. The Helena Food Share, well, actually, just in general, all of these organizations could use funding. And so if you have an inclination to send resources to any of these organizations, there are websites or phone numbers that you can call to send money to the organizations. We've talked about joining caremongering on Facebook. What I see with a lot of the work that's going on in the community is a lot of these organizations are kind of coordinating across and sharing resources. And if one organization has a little bit extra of something, a lot of times they're sending money or resources or food across to other community members or other of these nonprofits to share the resources across. But one of the things that I will say is Helena Food Share needs money in particular. I'm going to put in the chat box a couple of the URLs that you can go to if you are interested in looking up how to contribute to the YWCA. The Friendship Center, of course, always needs money as a resource, and God's Love and the area schools also, you can find ways to contribute there. And I'm just going to do kind of the short version of this and say I'm going to put some URLs in the chat boxes, but go out to caremongering, take a look at what's going on, and contribute where you can. And I'm going to go ask if we can go to the next slide, McKenna. Yeah, there are a number of URLs right here that you can seek out. And in particular, I'll point to a couple. United Way is one that you can always go to, and that's a place where you can always find a way to help. I mentioned the Helena Food Share. If you're looking for a way to immediately help what's going on in the hospitals. The Red Cross is a way to donate blood. I think that Eric put a link just in the last minute or two out related to the Lewis and Clark. Let's see, Lewis and Clark, where was it? Lewis and Clark Public Health and Lewis and Clark County Public Health. So there is that. But always there are places in these in community spaces for you to contribute. And I'll put some of these links also in our chat box. And McKenna, I'm going to hand it back over to you.
Okay. Sure. Thanks for sharing that, Kathy. I found it interesting that that Helena Food Share really isn't looking for supplies at this point, just because of potential for contact and spreading the virus. So it was interesting to hear about some of those pivots when we did our roundup preparing for this webinar meeting. But at this point, I want to open it back up. Yeah. To just know about any other needs that people are hearing about, even if it's firsthand knowledge, or things that you've heard from other people on a one-on-one basis. I think it goes back to Max Milton's question, more so about how like we're only plugged into our little niches of Helena, and so getting the fuller picture of needs and a bigger picture here would be really useful at this time. So does anyone have things to add? I'll be monitoring the little chat box, or if people want to raise hands and say something, we'll open it up for that. Okay, let's go with Bonnie.
I just want to say that we've started putting out our flyers, as we already mentioned, and I suspect that in the next week we will I hope that we will get some responses from people who need stuff. We've gotten already, even without putting out the flyers, but from the email we sent out to several hundred people, we have a lot of people signed up willing to help. So now that the flyer is getting out onto doors, I think that we'll be getting requests for help. And so we can hopefully tell you at some other meeting that these are the things we found and that we've been able to respond to. But I think it's just started getting people the information like, okay, if you need something, talk to us because we're here for you. So I think it's a little bit early, and we're I think one of the few groups that's being really proactive in asking the question instead of just putting out, okay, we're here to help, call us. You know, I think most of the stuff I've seen is, you know, United Way will help you, but they don't reach out specifically to individuals. So I hope that we can help some people. I hope that we find them, or maybe we won't find them because maybe no one needs help, and that would be fabulous, but I'm afraid that won't be the case.
Yeah, that's poignant. Good point there, Bonnie. Interesting to hear, and I want to thank everyone in the Helena Solidarity Network for getting the word out there, because it isn't easy. I think Julie brings up a good point about if you don't have internet or access to cell phones, like that kind of limits your contact. So thinking creatively about that is great. Denise had her hand up next, and then after that will be Marshall. Denise might be frozen. Oh, you're back. Okay.
Oh, I'm back. You know, I actually can't remember what my question was. Oh, I do. Yeah, I remember it. Okay, this is for the public health officials still online. Do we know, or is it known yet, that once you've had it, you have the antibodies and you are immune?
That we're not, the science isn't there yet. I mean, we don't even know how this is going to react to development of a vaccine. You know, will it be something like the flu where it mutates enough where we don't have an opportunity for sort of a, you know, a vaccine schedule to take care of it for life. I think that I've heard that there are certain markers. I don't deal specifically in that clinical side of this, but there are certain markers that are encouraging with this virus that it may be something we can manage, such as measles, where you would get a vaccine and it would protect you for life with a high efficacy. But it also could be something that it's an RNA virus, so it could be something where it changes enough where we're subject to an annual process to vaccinate against it. I just don't have the answer to that. I don't know. I hear a lot of information on both sides of that, but I just think we need to wait until we have more direct information related to that. Sorry about that.
Well, then how do we know it's safe to go back out? Like I think you used a term, something like, it wasn't community immunity, but
Herd immunity.
Herd immunity.
Yeah. Community immunity. Yeah. Same thing.
And so I'm just talking about between now and when a vaccine comes out, which is going to be several more months. It's still very unclear to me, and I think to most people, what happens when we start being allowed to go back out.
Yeah, I think that's a big concern. You know, this is a virus. It's a highly contagious virus. It takes one person to continue that outbreak within our community. I would err on the side of caution. I think that, you know, the controls that we have available right now without prophylaxis, without a vaccine, are what we're doing, which is living a little bit differently and isolating ourselves away from each other, or socially distancing ourselves away from each other to stop that. We can't go on doing that forever. We're human beings, and we rely on each other. You know, I kind of alluded to there's a couple things that will happen here. We'll either go through disease or we'll have prophylaxis. The population itself, you know, it's dependent on what proportion of the population has had one of those two things occur when we're going to be absolutely safe against this disease. We don't know when that will be. I'm really hoping, and indications are that we will have a vaccine in a year to a year and a half. But until that time, when we do start to open, we are not going to be able to open and live the same way that we lived before. We're going to need to be cognizant of, you know, don't get together with large groups at this time. Don't, maintain good hygiene, hand washing, wash your hands we're going to have to do the things that we're doing right now, a little bit relaxed maybe, but we have to understand that just because there isn't an order, we have to live a little bit differently until we get to a point where we have those protections in place. It's a pandemic. I don't know, it'll swash around, it'll go hemisphere to hemisphere, it'll do what viruses do. It'll move through the population. We're this first wave, like I said, social distancing is sort of inherent in Montana communities because of the way that we live and we're separated from each other. So it might happen here through little hot spots, and we might be able to understand through testing, both serological testing and or disease testing, what populations are ready to go to be more opened up, what populations aren't, and where we need to refocus and focus again on distancing ourselves and social distancing protections. That's going to be really complicated, and it's not a real easy answer. But as I said, there's two ways. You either get disease or you get vaccinated. That's how this thing's going to go down. And hopefully, as we said, we won't have to go through the disease. We'll have prophylaxis, and we're set up in Lewis and Clark County and in Montana to be a good test case for that because of the level of disease we're seeing.
Okay. Thanks, Denise, and for that helpful answer, Eric. We're really putting you on the spot here, but thanks for being open to
yeah.
to.
And I wish really wish I had better answers than that. I mean, this is a disease. It's communicable disease. It doesn't play by any rules. It just does its thing until we get protections.
Okay, Marshall, you're next.
Thanks. I think it's safe to say that it's too easy to say, actually, that going back to the question is what are the community needs, without doing any kind of rigorous examination of what actually is needed in the community. We can safely say that most people are going to need cash. There were, you know, it's estimated 20% of the people in Lewis and Clark County don't have internet access. It's not because they don't want it, it's because they can't afford it. Especially, and that's only exacerbated by a lot of people recently losing their jobs, and the kind of wait times that are going to be for people to get any kind of assistance that they're entitled to from the federal government or the state government, as far as unemployment benefits or other kind of benefits that came through the recent CARES Act. So we need to be constantly cognizant of the fact that the people who are most exposed to risk in this pandemic are people who are actually most exposed to any kind of risk, and it's defined by how much money they have to solve their own problems. And we live in an entirely unequal society, and one thing that we can do as a community is make sure that that risk is lessened, especially in the time of a pandemic.
Yeah, really good words there, Marshall. Thank you. Thanks for sharing that, and thank you for your work and your response to exactly addressing that issue of inequality. I think it's really critical that the more we say it, the more we get it in our heads that it's the issue we need to be addressing right now. Okay, well, just because we're almost done here, Diana has a couple announcements. The last thing we were thinking of was creative ways to come together as a community. So I'm sorry that we're trying to end promptly at 8 o'clock so that we can all go out and howl in solidarity here. I see that Jesse has a question about code, and Julie also had a question too, but we'll try and address those after. I think we'll try and follow up afterwards, and we have everyone's contact info if we're okay moving forward with that. Okay, thanks so much. Diana.
All right, you want to go to the next slide then? Or, well, I can quickly talk about, yeah, there we go. So Earth Day is coming up. It's the 50th anniversary of Earth Day, 1970 to 2020, April 22nd, next Wednesday. And if you wanted, we're going virtual due to the current situation. Check out earthdayhelena.org for the updated virtual activities you can do and some suggestions either you can do with your friends and family, socially distant, or physically distant, socially connected. And then the next Resilient Helena Learn and Act meeting will be June 9th, and we'll be talking about climate adaptation and mitigation. So we will share this slide deck. We'll post it on our website, and we'll capture, kind of clean up the chat and share some of the, share the links and stuff too. So with that, we wanted to end precisely at 8 so we could go outside and howl for Helena and all the frontline workers. So with that, I want to thank everybody for joining us tonight, and be well and stay strong.
Thank you all for coming.
Thanks, everyone.
Thank you.
Thanks,
you.
guys.
Thanks to the speakers for sure.
Good job.
Thanks for the
Thank
opportunity.
you very much for organizing this.
Oh, you're welcome. Thanks, everybody.
All right, take care.
Bye.
Bye.
Bye-bye.
Take care.